Okay.
Welcome back to Inside Chlorpromazine, the podcast where we unpack the science behind an old drug finding new relevance in today's medical challenges. I'm your host Sowmya, and you're listening to episode 8, Neuroshield. Can chlorpromazine protect the brain in COVID and long COVID? This episode takes us deep into the brain, a system highly vulnerable to viral infections, inflammation, and disruption, especially in the case of COVID-19. Today, we are going to explore the neurological complications of COVID and long COVID and whether chlorpromazine has any neuroprotective potential. Helping us navigate this topic is our guest, a microbiology researcher with a background in neuroinflammation and host pathogen interactions. Welcome, Chaitanya.
Thank you, Soumya.
Let's start with the foundational question. How does COVID-19 affect the brain?
That's a great place to begin. While SARS-CoV-2 is primarily a respiratory virus, a substantial number of patients, both during acute infection and long after recovery, report neurological symptoms. These include brain fog, headaches, anosmia, memory issues, anxiety, and even depression. In severe cases, we have also seen stroke and seizures. Researchers believe this happens through a few mechanisms. First one is this neuroinvasion, means the virus may enter the brain by the olfactory nerve or by crossing the blood-brain barrier. Second one, systemic inflammation. The cytokine storm can cause brain inflammatory indirectly. And third one, endothelial damage and clotting. Microclots and hypoxia can lead to ischemic injury in the brain.
So, where does chlorpromazine come into this picture?
Chlorpromazine has unique properties that make it potentially useful in this context. First, it's lipophilic, meaning it can cross the blood-brain barrier effectively, a key requirement for any neuroprotective agent. Second, it's been shown to inhibit microglial activation, which are the immune cells in the brain. When overactivated, which see in COVID and long COVID, microglia can produce neurotoxic cytokines and damage neurons. Chlorpromazine appears to downregulate this overreactivation, reducing inflammation in the brain without shutting down immune functions entirely.
Most people know chlorpromazine as an antipsychotic, but its neurological effects extend beyond dopamine receptors, right?
Exactly. While it was first developed to manage schizophrenia and psychosis through dopamine D2 receptor blockade, chlorpromazine also interacts with serotonin, histamine, and adrenergic receptors. So these systems are deeply involved in sleep, mood, cognition, and pain perception, many of which are disrupted in COVID, long COVID. So additionally, studies have looked at chlorpromazine's role in reducing excitotoxicity, damage caused by excessive stimulation of neurons, which is relevant in viral and post-viral syndromes.
So, do we have any data or findings on chlorpromazine's neuroprotective role specifically in COVID-19?
We have a few emerging pieces of evidence. First, in vitro studies suggest chlorpromazine can reduce neuroinflammation markers in brain tissue models exposed to SARS-CoV-2 proteins. Second, clinical observations shown psychiatric patients on long-term chlorpromazine therapy were less likely to report long-term neurocognitive symptoms, although more rigorous trials are needed to confirm this. Lastly, animal studies using viral models have demonstrated that chlorpromazine can reduce blood-brain barrier permeability, protect neurons from cytokine damage, and improve behavioral outcomes.
Brain fog has become one of the most talked about symptoms in the long COVID. Could chlorpromazine help here?
Potentially, yes. Brain fog is thought to stem from a combination of neuroinflammation, microvascular dysfunction, and altered neurotransmission, all of which chlorpromazine has some influence on. In fact, some researchers are exploring whether low-dose chlorpromazine could be repurposed for treating persistent cognitive symptoms because it also has anti-anxiety and mild sedative effects. It might help manage the distress and insomnia that often accompany brain fog. But we should be very clear. This is still a developing area, and any therapeutic use would require controlled trials and personalized risk benefit evaluation.
Neuroactive drugs often raise safety concerns. What are the key considerations here?
Chlorpromazine is generally well tolerated, especially at low doses. But like any CNS drug, it can cause sedation, extrapyramidal symptoms like tremors, and in rare cases, tardive dyskinesia if used long term. For potential COVID-related use, researchers are looking at short-term, long-dose regimens that could limit side effects while still offering neuroprotective benefits. Again, it's not a dissolution. It would need to be very carefully studied and prescribed.
DIY solution. So, to summarize, chlorpromazine may offer protection against brain inflammation, cognitive issues, and neurological complications from COVID and long COVID. It's not a silver bullet, but it's definitely a candidate worth investing further.
Absolutely, it's a classic example of drug repurposing. Taking a note compound with an established safety profile and exploring new therapeutic frontiers based on evolving needs.
Thank you so much for joining us today, Chaitanya. Your insights have really illuminated the science behind neuroinflammation and the intriguing possibilities of chlorpromazine.
Thank you. It was a pleasure being here.
And that's a wrap on today's episode of Inside Chlorpromazine. In our next episode, we look at the cellular entry mechanisms of SARS-CoV-2 and how chlorpromazine might block viral access at the membrane level. You don't want to miss it. Stay safe and keep asking questions. Thank you.